very good. And the other aspect really is, again, looking at the role of the rib rings, trying to make sure that the canister treatment respects the alignment and mobility of the rib rings. As you know, we use the muscles to restore the stability, or we use the muscles to restore the mobility. But I think that monitoring the rib rings during movements of the extremity is a good way of seeing if they are stable, because we use breathing and bracing to stabilize, but we must also make sure that that stabilization is actually taking place. And I remember taking a class from
One of the are you
Linda
talking one of the
Lee.
Prague PTs?
No, oh,
It's not Diane Lee and
Diane Lee, yes, thoracic rings.
yes,
I
that's right.
remember taking that many years ago, and I put it in the back of my mind because I thought it was important, but at that time it required a lot of manual skill, and I did not know if I had the ability to feel as much as was required to make it worth the time I was going to put into it for assessment. I had no clean way of assessing it consistently. But I think that now it is more obvious, and there are ways of looking at how stable the rings are or not. And
So let me ask. Hold on. Let me ask a question. I mean, two things. You said in the very beginning of that how we use the muscles to mobilize the rib cage, and I just want to
mhm,
clarify for people listening that yeah, that's exactly what he said is exactly what we do. If we find that somebody's rib cage is stiff, rigid, dysfunctional, right, we can, as a chiropractor, I might adjust and mobilize somebody's thoracic cage and ribs. That's perfectly acceptable and useful. But other people, and Robert will show and demonstrate in the courses that we'll use kind of eccentric stretches, contract, relax stretches for particular muscles that actually attach onto the rib cage to mobilize the ribs themselves. And that's kind of what we were talking about. But then you also, you said, I mean, basically, you said like it's one thing to make sure that the canister is stable through breathing and bracing,
mhm.
but then it's another to make sure it's stable, I think, when the extremities are in function,
Yes, you
and
must
you were linking
test
that to the
that
rib
these,
cage.
yes, you must test that the rib rings are themselves stable, that there is no escape, because sometimes there's a hypermobility or a shearing or a collapse, and that alone can become a chronic um, challenge to the stability of
That's the
the whole
compensatory
canister.
pattern.
That's right. So we must know that, we have with arm movement that the rib rings themselves are staying in line and not escaping one way or another. Yes.
Get close to the mic.
Sorry. So
Yeah.
that
Too bad.
they are not escaping
Okay.
uh, from side to side. Yes. So
So
if
I
I
think,
have the rings, they're stacked and they're
yeah.
not collapsing with
And I
load.
think I mean, are you trying to say like, again, it's one thing to not have your arms moving and have a stable rib
That's
cage
right.
function with breathing, but once you start moving your arms,
Mm-hmm.
the muscles that basically connect your arm to your rib cage will
Mm-hmm.
either tug on the rib cage, or they're
Maybe.
affecting the rib
That's
cage in
right.
some way
That's
that
right.
it's no longer stable anymore. It's
That's right.
actually
And I'm,
collapsing or
yes. And
tugging
this
or
is
sliding.
important, especially with asymmetric movement. It's one thing when you lift both arms up, on your back and you say keep your ribs down and you move both arms. But what is happening when you move one arm
Hmm.
as opposed to the other, or you move one leg as opposed to the other? So I think that that is something that needs ferreting out and refining in our assessments. And this um, again has far-reaching consequences for the overall function of the extremities and their stabilization strategy. So those are aspects of the work that I think are exciting and challenging for me in clinic right now, just making sure that there's a system by which I can reliably test this, and not just by feel alone. I must have some objective measure that allows me to implement a certain treatment,
Yeah,
and
I
not
mean
just a subjective measure. Yeah.
I mean that's what makes it beautiful, because the reliance on, your ability to palpate things is nice, but that's not as objective as we would like it to be.
No.
And having multiple things rather than just the one thing of feeling
Yes.
it, multiple tests, different
Yes.
kinds of tests to point
Confirmatory
to.
tests, yes,
Yeah,
must
yeah,
come together. So
yeah.
it is exciting. I'm excited by the presentations, the patients I've been seeing, and what and applying the integrated function and approach to it. And then I think when we look at the um, some of the exercises, I've been trying to modify some of the exercises to take into account a lack of, what did you say, the patient just does not feel the muscle part. Or they think they're doing it and they are not. For example, many times you may find a patient who really thinks that they are using their abs, but really they're using just parts of it. They're using erectus abdominis predominantly to move the pelvis or to control the pelvis. And
Mhm.
that by changing the angle of the hips, you can then affect which parts of the abdominal wall you are going to load. So you can help the patient actually um, start to access muscle areas or muscle divisions that they normally cannot access, and they cannot do that voluntarily.
It
And
almost
since
kind of goes hand in hand with the old idea that we would say, like, it isn't, muscle, the inhibition or muscle weakness that we find is not strength weakness. It's just
mm-mm,
they can't find or feel the muscle. And
mm-hmm,
if you give them the adequate support point,
mm-hmm,
they feel the support that facilitates the muscle, and then they can feel it.
that's
You're
right.
Rather than support, you're altering the angle of the hip or the pelvis
Mm-hmm,
to give them the feeling to
mm-hmm,
access particular aspects of
that's
the
right.
abdominal wall, for example,
Yeah,
or something
that's right. So you have one of two things. You can change the support and you can alter the position.
like that.
And that's
Yeah,
really what you can do. And so, in cases where the support can't be altered, then you have to change the position. In cases where the position can't be altered, then you have to change the support. You have to add the support, take away some, etc.
yeah.
So this playing with the developmental sequence of variations of it, and looking at how you can find reliable variations that will give you predictable um, responses. This is another stage in trying to understand how broad the toolbox is in terms of the DNS model. Mm, and I think, again, one of the things I really tried to do in recent is to reiterate showing the plan movement from beginning to end with all its variations. Because
Reiterate that in courses, you mean?
yes,
Or yeah.
yes, yes. Because I have found that I've taught a B or a C, and I go, show me the plan movement pattern, and they don't know it. Some people have done it a long time
Mhm.
ago, but in recent courses, they've only done positions. So they
Mhm.
don't know the whole plan movement pattern. And so going back, plugging that in, and insisting that it be known has been important, because I tell them it's the meat and potatoes of the course. You don't know the plan, movement pattern, good luck.
Right, right. I mean, it is. I mean, I kind of, yeah. I think I use like the idea of the positions are kind of the basic vocab words.
That's right.
Then you have to learn the plan movements because
That's
you're
it.
putting the vocab words into sentences now.
That's right. You've
You
got to
can't
have
just use put
sentences.
words. You have to
Yeah, you
create
just can't plug
sentences
in
and
words here
paragraphs.
and there. It
Right.
has to make a sentence, it has to make a paragraph, it has to be understood for what it's going to be.
Yeah, I mean, you. I mean, base again. It's just very practical. You have to understand how you go from lying on your back to fully standing,
That's
from
right.
lying on your tummy to fully standing. How does
Exactly.
that happen? And all the options in between.
Yes.
If
And
you
one thing,
enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.